Hi, my name is Catherine Price. I'm a physical therapist. Please consult your medical doctor or physical therapist for the appropriateness of exercises for you. First, I'm going to begin with a word of life from 1 Samuel chapter 16, verse 1. The Lord said to Samuel, "How long will you mourn for Saul, since I have rejected him as king over Israel? Fill your horn with oil and be on your way. I am sending you to Jesse of Bethlehem. I have chosen one of his sons to be king." How often we tend to mourn over the past, and the Lord is telling us to move forward and move towards the life that he has planned for us. So today I am going to talk about Piriformis Syndrome, and this is a literal pain in the buttocks. And it needs to be discerned from any other problems, so you do want to consult your healthcare provider, whether it's your medical doctor, physical therapist, to make sure that this is an appropriate diagnosis before you even try these interventions or treatments. So what I like to do, once you've established that it is Piriformis Syndrome, this is what I will go through to treat. And to establish that, one thing is to lie on your back, and I'm going to bring my knee to my opposite shoulder, and I'm just going to pull in, and I'm just going to assess, do I have any tension or pain in the upper portion of my buttocks? And then bring that leg down and then compare it to the other side. Do I have any tension or pain in my buttocks when I do this? And so when I am doing this, currently I feel a little bit more tension in my left side. Now, if the rotators are tight, you can get some hip impingement. You can actually feel some discomfort in the front of the hip. So the muscle that we're going to address is your piriformis. And if you find those two bones on the very bottom back part of your spine, upper buttocks region, that muscle is going to be attached to the front of the sacrum, which is a triangular bone at the bottom of the spine. It goes from the front of that sacrum, so the very upper portion of the buttocks, all the way around to the outer portion of the femur called the greater trochanter. And so that muscle is going to extend and externally rotate the hip. The problem with the overcontracted muscle is that it can clamp onto the sciatic nerve, and you can get sciatica provoked from the piriformis muscle. So I will show you how you can alleviate some of those symptoms. And if you spend a lot of time sitting and have a problem with this muscle, it can be painful and irritate it. If you run downhill, you're controlling that forward movement, and that can irritate the piriformis. And a control leaning forward or having that bend and while you're contracting the muscle can irritate the piriformis. So I like to use the release, stretch, and strengthen technique to address Piriformis Syndrome, and then I do add in the sciatic nerve mobilization. So the reasons the sciatic nerve can get irritated is that nerve can go underneath the muscle, through the muscle, or over it, and when you're contracted or over contracting in that muscle, it can clamp down onto that sciatic nerve, and that can send pain down the leg. So this is going to be upper buttocks pain, but it can refer to the whole area of the butt, and it can also go down the back of the leg. So the first thing I want to do is I want to release my piriformis. To do that, I'm going to use a 5-inch ball, and I'm going to come up onto that piriformis, so it's the upper part of my buttocks. And I'm going to get in a kind of butterfly position. I want to be on that upper part of the buttocks, so that where you feel the very bone at the bottom of the back of the hip, you can go out just a little bit and down, and that's where you want to place the ball. And then I will roll an inch upward and an inch downward, and you will localize the area of tension or tenderness. And what you want to do is you want to find those areas, and you want to hang out there and let that tension release. As the tension releases, you should feel a reduction in the tenderness and pain. So if you start to get pain down the leg, you can reproduce some of the trigger point symptoms, but you don't want to hang out on the nerve. So if you're feeling nerve sensation, either pins and needles, tingling, you want to move off of that. So I am going to hang out on that area that feels tight, And then to actively release, I'm going to lift my knee and bring it back down. Now I can use my other hand to balance myself and support. So I'm just finding that piriformis muscle, holding myself there, and then I'm just going to actively release this. I can pump my leg up and down about 15 times, roll to another area, and pump up and down. And you're gonna stay in a pretty localized area. Now, you can use a lacrosse ball, tennis ball, small. You can use something smaller that's gonna be a little bit more pinpoint on an area. I like to start with a larger surface area, and you can work to a smaller surface area if there's one particular place, and you can find that one pinpoint area and you can work on that as well. So first I'm going to release that muscle, then I'm going to stretch it. To stretch the piriformis, I am going to bring my knee to my opposite shoulder and I am going to hold that. Now as soon as you release it, if you then go into the stretch, you should feel significant difference if it has been effectively released, and you should feel more ease in going into the stretch. And if you're having that pinch on the front of the hip, that should also be subsided. So you don't want to hold the stretch if it's painful. If you are comfortable in the stretch and it just feels like a stretch, then it is fine to do that. But it should feel better than when you first assessed it. And then you want to come out of that and go right back into it. And 3 times 1 minute or 3 times 30 seconds is going to be sufficient for the stretch. And you just want to hold that. And take deep breaths. As you exhale, try to bring that knee further over to the opposite shoulder. And you're just going to relax into that stretch. I'm then going to come right back out and then go right back into my last stretch, bringing my knee to my opposite shoulder. And then by the time you finish the release and the stretch on the hip that has the tight piriformis, it should feel more symmetrical and equal to the other side. So you're going to gain the flexibility in that muscle. So you want to release the piriformis, you want to stretch it, and before I strengthen it, so then you want to re-educate the muscle and strengthen it. But before I do that, if you are getting the pain that goes down the back of the leg, you want to mobilize the sciatic nerve. And so I'm going to show you how to do a sciatic nerve mobilization. So to do that, you want to have you can use a rope, a leash, you can even use a sheet. I'm going to hook the leash over my foot. I want to bring my leg up, and then I want to bring it across my body. So this is hip adduction. And then I want to pump my foot up and down. And this can feel nervy. So this is called flossing your nerve. So we're flossing the sciatic nerve. And I'll just pump my foot 5 times, bring it back over, and that should ease the tension off of the nerve. I bring the leg across my body, that puts the nerve on tension, and then I wave the foot up and down. So when the nerve is compressed, it can be irritated, and when you floss the nerve, you're just allowing the nerve to move more freely and not get caught up in the tightened tissue. And bringing it back off. And these are the basic exercises that I'll start with. More can be involved depending on how chronic the problem is, but this is a good place to start if it is a true piriformis syndrome. So after I have mobilized my sciatic nerve, then I'm going to strengthen that piriformis muscle. So to do that, I am going to grab a band. And what I like to do, the piriformis is going to extend and externally rotate your hip. I am going to then perform a clamshell. So I'm going to lie onto my side, and I am going to rotate that knee up towards the ceiling, and I'm going to engage that muscle. So I want to do this 20 times. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. I am then going to do a hip abduction exercise, but I'm going to rotate my foot and bring it behind me slightly. So I am going to extend my hip and rotate my foot towards the ceiling. And I'm going to do this 20 times. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and last one, 20. So my leg is slightly extended, my toe is slightly turned up towards the ceiling, and I'm lifting the leg. Then I am going to perform a bridge. So I'm going to be on my back, and I'm going to extend my hip. Now I'm going to push my legs out and hold my right leg out to the side, and I'm going to work the left side, and I'm going to just push my body up and come right back down, and I'm going to do that 20 times. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. And those 3 are good strengthening exercises to start with. As I progress and I want to challenge a little bit more, I can do this on both sides. Go up into a modified side plank, and I am going to lift and externally rotate that leg. So I'm going to bring my hips down and push up. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. And then I'll do this on both sides because you can work the muscle both in the top leg and the bottom leg as you do this. So I'm going to drop my hip down, push and externally rotate the hip as I come up. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and last one, 20. And that completes some strengthening for the hip rotator and to begin to re-educate that piriformis. Now, you can lie back onto your back and you can just reassess and see how the hip feels. And by the time you finish, it should feel better. If it does not, then these are not appropriate exercises for you. I hope this is of help and have a blessed day. Thank you.